Namaskar. Good evening. I'm Dr. Rajiv Thukral. I'm a senior consultant orthopedics, joint replacement surgeon at Apollo Hospital, Noida, Greater Noida. On the occasion of World Osteoporosis Day, today I'm going to be giving you a small little talk. I won't use the word lecture, but a talk on how to keep your bones strong so that you don't need to come to the doctor. See, the first thing one must understand is that keeping the bones strong is something that we need to do at every age. So whether we are small little infants, where we are not in control of our own nutrition, to when we are children and our parents take care of our nutrition most of the times, to when we are teenagers and adolescents and we go out and we explore and have also all sorts of food that is available outside on the streets, to when we actually grow up and become parents ourselves, and then mothers, for example, have to take care of their own as well as their children's bones and your nutrition, to when you're older, when your bones get softer and weaker and you develop what we call osteoporosis, which is what this talk is all about. So let me start off with, first of all, explaining to you why and how osteoporosis develops. Now, osteoporosis, in very, very brief, is composed of two words. One is osteo and the second is porosis, which basically means porosity or holes inside the bone. Now, there's not real holes in the bone, but the bone, which is normally made of a strong network of fibrous tissue, which has been calcified in particular layers, has got increased pores, is becoming more weak as you age, for all of us, and much more in certain groups of people, especially in postmenopausal women who have completed the periods, or in males or women who have a long-standing medical problem, taking medication for a very long period of time, or who have been lying down for any reason, whether it is because of a disease or a lack of physical activity, and of course because of improper nutrition taken at the young age. So all of these collectively lead to weakening of the bones, and usually it happens, like I said, in women post-menopause, which is around the age of 40 to 50, and in men much later, when we call it andropause, the age of about 70 or 80. And much younger, it can happen in everybody because of the other medical conditions I mentioned, or because of taking long-standing medication. Now, having said that, before osteoporosis, there is a condition called osteopenia, where it is a stage where you have weakening of the bones, not because of, say, loss of the protein or matrix structure of the bone, but because of inadequate calcification of that sort of protein matrix. So osteopenia, or in young adults we call it osteomalacia, happens because of deficiencies of calcium, vitamin D, and other nutrients that make up the bone matrix and calcification of the bone. And in children, the same deficiency of vitamin D and calcium produces a deformity, a problem called rickets, where you have deformities in the bone and the bones change their shape. You have knock knees, you have bow legs, you have pigeon chest formation, etc., etc. So how does one actually work towards keeping the bone strong and preventing all of this to happen, are by a sort of very simple and very logical methods. The first, of course, is to ensure that you have a good nutrition. Now, by good nutrition, we have to be understanding that Indian food or Indian diet, especially the vegetarian diet, is very low in protein, and bones are made up of, to a large extent, water and protein, because that forms the matrix, the ground substrate onto which you have deposition of calcium and other elements which make it strong and hard. So you need to have the strong foundation. For that, you need to have adequate amount of water and protein. Now, if one looks at a small child in our country, say, still an infant, he is or she is fed by the mother's milk, and that usually constitutes adequate amount of protein for the child, for the infant rather. But as you get older and you're walking around, running around, and jumping and playing, you need to have a good high protein diet, which consists of not just milk but also things like eggs and dals and paneer. Because in vegetarian diet, you don't really have too many sources of protein apart from, of course, you have soya. So from vegetarian sources, you can get protein only from limited places. So that's one way you should improve your diet. And if you're a non-vegetarian, then you have options like eggs and meat and fish and chicken, which will also give you protein, which is helping building your bone substrate or the bone matrix or the bone ground material. Now, that of course is just as far as the water and the protein go. But you must understand that to make this soft substrate hard bone, you also need calcium and vitamin D. Calcium, because calcium actually deposits along with magnesium into these substrate and produces the strength in the bones. But vitamin D, because you need vitamin D for absorption of calcium from whatever you have in your diet. So that is why whenever we talk about nutrition, we talk not just about water and protein, but also calcium and vitamin D. And sometimes, again, because of Indian vegetarian diet, vitamin B12 as well. So five constituents of a good nutritious diet are essential for keeping bones fit. Now, this all works if you have a good balanced diet when you're young, but as you become a teenager and you become an adolescent, you start going outside and having street food and you focus on giving yourself more of junk food, then you end up actually changing the balance. And there you will cause gradual depletion of your calcium, gradual depletion of the protein in your bones, causing weakening of the bones. And therefore, even at the young age now, we see people who come to us with Malaysia and osteoporosis. Before we understand what can be done in terms of treatment, we must understand that nutrition at this age is also very important, because at that age you are exposed to different kinds of food that's available outside, and we end up ignoring what the body really requires, and the bones become weak. So when you're there, passing from a teenager to the second decade or third decade of life, when you're going to get married and have your own children, at that point of time, not only do you have a low initial bone sort of bank to start with, but you also lose bone when you actually have a child. I'm talking about the mothers here, because they have to give quite a bit of their own nutrition to the child, to the unborn baby in their womb, and when the baby gets delivered in the form of milk, breastfeeding to the baby. So at that point of time, it's really, really important, the women especially, and of course the men, because they are taking care of the women who are pregnant and all that, but both of them to take care of their calcium and vitamin D intake along with protein intake. At that point of time, you need it much more than you need it otherwise. And we say that breastfeeding women require almost 1500 milligrams of calcium every day, which is about 3 glasses of milk every day, so just to go by milk. Then, of course, there's milk products, so you can bring it down to 2 glasses of milk a day. But one must understand that usually in our country we also have a problem of vitamin D. And that is because when it is summertime, we tend to stay indoors. We are shying away from the summer heat. We want to stay in air-conditioned rooms, not go outside. And when it's winter times, then we actually cover the entire body with woolens, and we don't let the sunlight actually activate the inactive vitamin D that's lying in our skin, converting it from the non-hydroxy to the 1-hydroxy, and then sort of go to the next step in the hydroxylation of the vitamin D for it to be activated. And therefore, even though in our country we have like sunlight almost throughout the year, we still have deficiency in vitamin D. There's no plant source of vitamin D. There is not really much of animal source of vitamin D except in cod liver or fish liver oil, and that's not something we normally have our food in. So we end up having vitamin D deficiency very, very routinely, whether it is at young age or a middle age or older age. Now let's jump forward to when we actually start reaching the middle age and the older age. For women especially, as you reach menopause, you actually reach a point where the sex hormones, the quantity suddenly stops, because the reproductive organs, the ovaries stop producing eggs, and because the hormones stop functioning, and then you have a sudden drop in your bone mineral density, the bone strength, and that is when you are at risk of actually what we call developing osteoporotic fractures. Of course, to add to the problem that the women face, men being a little luckier that they don't have reduction in their hormones, sex hormones, but they do have a weakness if they've been having a bad lifestyle to start. That means they have a low level of a bone bank to start, or they've been having multiple medical problems or long-standing disease which is causing them to sort of be less active and immobile, or lying in bed and not doing enough physical activity, or have been taking medicines which actually reduce the absorption of calcium or vitamin D, like blood thinners or such medicines, or they've been having say medical conditions like diabetes, or they've been taking steroids for asthma, or they've been having hypothyroidism or rheumatoid arthritis. All of these indirectly sort of reduce the bone mineral density and bring down bone strength and bone health. So, if you are already having a medical condition, then of course you are at higher risk of developing osteoporosis. So, you must be especially careful of taking care of your bone health when you're young, so that you have a higher level of a bone bank to start with, so that when you actually have osteoporosis, or when you actually have, say, menopause, the drop is not too bad. But if you already have taken care, improper care of your bone health when you are young, say around the age of 20 or 25 or 30, then you're already at a loss and you will already easily develop osteoporosis as you get older. So now that we've established that diet has a very, very important role, understand that just as important as diet is the role of exercise. If you do not exercise, whatever you actually sort of ingest, whether it is through milk products, or proteins, or calcium rich foods, or vitamin D supplements, your body actually will not absorb them. The body only can take in what it requires and asks for. So if you challenge it by giving regular exercise and providing stimulus to sort of absorb whatever nutrition you're taking, only then will the effect of this good nutrition work. You cannot sit in your chair at your office every day and say that I'm going to have a protein shake every morning and evening and expect all that protein to get absorbed, because your body will reject it. So you need to give stimulus for whatever you're expecting to get absorbed in your diet, whether it is calcium or vitamin D or B12, or even high protein. So, as important as diet, it is important to take care of your physical activity and be exercising. Now, I'm not telling you to go to the gym and pump iron and lift weight, but at least start doing some stretching exercises on a daily basis, some light weights exercises, or some daily walk, so that your body actually sort of asks for more nutrition and actually uses or absorbs whatever extra supplements the doctor prescribes to you or you take on your own. So these are two simple things you already know about. One is diet and the other is sort of exercise. And this is the basis of health, whether it is medical health, whether it is diabetes, whether it is hypertension, whether it is heart disease, and it is the same for bone health. So remember, two things one must take care of. One is good diet, and the second is good exercise, good stimulus. But what happens if you do have a deficiency? Now, how does one actually notice that? How does one actually understand that you have a deficiency? Osteoporosis itself is a very silent disease. There is no real symptom. Most of the times, patients come to us with fractures. Simple fall and slip at home, fall on the hand, wrist broken, fall on the side, hip broken, or had a bad cough and the rib broke, or you had a slight jerk while traveling and you had a spinal fracture. So all of these are indirect signs. If you have a fracture, is how the patient presents to us, the osteoporosis. The other signs, which are actually something very subtle, are those that you start feeling fatigued and tired in the evenings. You find that the amount of energy that you had in the beginning, you don't have anymore. And that usually most of us experience and put down to age. But one must understand that there's a difference in the kind of weakness and fatigue that you develop with osteoporosis compared to what you have with age. So you obviously need to understand that if it's happened after, say, menopause, then it is most likely because of osteoporosis. If it has happened gradually over time, as you are plus 70, then you're looking at age. So then again, it also depends upon what level of bone bank you started off with. So I hope I've made this part clear. Now, once you have a diagnosis of osteoporosis, whether it is because you come to the hospital following a fall, what we call a fragility fracture, a small little light fall, and you have a fracture, that is the way you present, or you have a report because you went to the doctor and the doctor asked for a DEXA scan, and the bone mineral density showed that your bone mineral density levels are very low, and then doctor said, okay, you have osteoporosis or osteopenia. What do you do then? So understand the treatment also is the same. It's predominantly going to take care of your nutrition, going to take care of your exercise plan. At the same time, there are nutritional supplements we give. Now, most commonly, all of us, even without the doctor's prescription, take calcium and vitamin D. But there's a logic behind it. We must understand that not only do we need this, but we also need a high protein diet. So people who are not taking enough proteins will not have much benefit. At the same time, it's very important to take a lot of water because we've all heard of calcium causing stones, whether it's in the kidney or the gallbladder. And we don't want you to sort of take calcium excessively and then have a different problem altogether. We would prefer that you have lots of water because that's also what the bones need. They need water, then they need protein. So that's a fundamental thing before you start prescribing calcium supplements, which is about 1,000 to 1,200 milligrams a day, vitamin D, which is about 2,000 to 2,500 units a day or 60,000 units a week, and vitamin B12, which is about 1,500 micrograms a day, especially for Indian vegetarians. At the same time, these are all medications we give on a routine basis for prophylaxis, and only when the patient is still in a stage where they can be controlled. Once the female crosses menopause, then you have no choice but to add other medicines which are substituting the effect of the hormones by preventing destruction of bone, which is normally happening as you age, or promoting the development of bone, what we call bone developing medication. So either you have anti-resorptives like bisphosphonates, or you have bone osteoproductive, osteoconductive, or osteoproducing, means bone producing medication like teriparatide or denosumab. All of these medications are available only after the prescription of a doctor who will first examine you, take your history, understand your problem, if necessary, do a test to diagnose the severity of your osteoporosis and then treat you. So to keep your bones strong, understand the basics, understand that you can have weakness at any age, but the common denominator in terms of prevention and treatment remains the same, which is good, nutritious diet and regular exercise. So that's in brief as far as the osteoporosis goes and how to keep your bones strong. I think there are a few questions. So I'll just quickly look at the questions and try to answer them. Yeah, so the first question someone has asked is, what are the key factors that contribute to strong and healthy bones? Now, I already mentioned to you that strong and healthy bones don't happen suddenly in a generation. So, if your lineage, if your ancestry has already got strong, healthy bones, you are starting off with a strong and healthy bone. But then, how you treat that, meaning your nutrition, your exercise regime, the kind of food that you eat, and whether you have any medical conditions during your life, will all affect how these bones will develop, whether they will continue to be healthy and strong or they will become weak. But no matter what, for a female post-menopause, there's going to be weakness of the bones. For a male, usually if there's a medical problem or there's a long-standing disease or there's a medication taken for a long period of time, there's going to be weakness. Keep this in mind. So contribute. Try to make sure that you start off with healthy bones, which is not under control, not controllable. But if you can control whatever you can by having good diet and regularly exercising, which means good protein, good water, calcium, vitamin D, rich diet. Okay. What role does vitamin D play in bone strength and how can I get enough of it? So I just explained to you that for bone strength, you need a substrate, which is the main substance onto which calcium must deposit. Now, the deposition of calcium in this substrate depends upon vitamin D. So, if you're deficient in vitamin D, your calcium is not absorbed from the blood and the calcium is not deposited into the bone. So, you must have vitamin D adequately. And now, how do you do it? I'll tell you. But for whatever calcium you're taking to go into your bones. So, how does one get vitamin D? Unfortunately, no plant or vegetable source except cod liver oil and fish liver oil. There is some in eggs, but it's very limited. Mostly, it's in vegetarian diet not available, and in non-vegetarian diet, as I mentioned before. But the interesting part is sunlight can actually activate whatever inactive form of vitamin D you have in your skin. So make sure there's adequate amount of exposure to sunlight, which means at least an hour a day. Another question out here which says, are there any specific foods that are particularly beneficial for bone health? Now, to understand this, I've already explained to you that the bone matrix consisting of protein and water requires vitamin D for calcium to deposit inside it. So you need all of these. Now the problem is in vegetarian diet you don't get neither you do not get high protein, neither you get vitamin D and calcium you do get, but it's usually not easily absorbable, especially if you're taking supplements after say green leafy vegetable meal or something like that. So there are calcium rich foods like like milk and milk products, paneer. Then there's of course protein rich foods, and then of course vitamin D only available in non-vegetarian diet, especially if you're cooking food in cod liver oil or taking cod liver oil or fish liver oil capsules separately. So make sure you're taking care of all of these. Another question is, how does smoking and alcohol consumption affect bone health, and what steps can I take to mitigate these effects? Now, see, understand again, bone health, of course, there are certain non controllable factors. For example, genetics, you can't control that. If you're born with good bones in the beginning, you're going to get good bones later on. But these are factors you can control. Smoking, alcohol, especially on a regular basis, actually reduce the amount of cross-linking in the bone protein matrix and cause it to become weak. So, especially smoking is one thing one should avoid completely. And alcohol is something they say good for your heart. You should take one peg a day, but for the as far as the orthopedic is concerned, you should not think about too much of alcohol because that also slows down bone healing and bone development. Okay. Another question, I think I'll just take this last one, is how often should I have bone density tests and what do the results mean for my bone health? Okay. All right. So usually we do not recommend bone density for a young person, especially otherwise active person who sometimes have aches and pains in his muscles or bones or joints. We usually recommend bone mineral density either in a person who's taking medication for a very long period of time, or a woman who is just postmenopausal, or a person who's been having a long-standing medical problem, or who has had a fragility fracture. In which case, we want to determine what is called the T score, which is a score which tells us what is the value. It gives us a number which is usually in either plus or minus, and anything less than minus 2.5 on that T score suggests severe osteoporosis. Somewhere between minus 1 and minus 2.5 suggests moderate kind of osteoporosis or osteopenia. And depending upon the severity and depending upon the associated fracture, then we treat it accordingly, either simply with medication, as I mentioned earlier, or with medication after surgical treatment of that complication of the fracture. And more important, I would just have to add one little thing before I close, is that understand that as you get old, you also lose balance. You're also not very quick. You're not reflexes slow down. So you need to prevent falls in these elderly people. So fall prevention is something that we take very, very lightly in our country. We should be very careful. Somehow make changes in our homes, in our environment, in our office spaces, in our entertainment places, so that falls can be prevented, or where they do occur, they do not cause bad fractures. That's one thing we normally speak less about. But just to summarize, on World Osteoporosis Day, I would like to again take this opportunity to tell you to please keep yourself fit and strong. Understand what constitutes bone health, what are the simple tips and tricks that one can do, and it of course depends upon a combination of good diet and regular exercise at a young age, also at a later age, but at a young age, so as to prevent this from ever becoming a problem and to keep your bones strong and healthy. If there are any more questions or if there are any doubts, you're welcome to call us or ask us anything.